Diabetes is a chronic condition that affects how your body processes blood sugar, glucose. In older adults, diabetes can lead to serious health complications if not properly managed. Understanding the signs, prevention strategies, and treatment options is crucial for maintaining health and quality of life. Recognizing the signs of diabetes in older adults. Diabetes symptoms in older adults can develop gradually and may be subtle, often being mistaken for normal aging. Common signs include increased thirst and frequent urination. Elevated blood sugar levels can cause the body to pull fluid from tissues, leading to dehydration and increased thirst. This, in turn, results in more frequent urination. Unexplained weight loss. Despite normal or increased eating, weight loss can occur as the body starts breaking down muscle and fat for energy due to insufficient insulin. Fatigue. High blood sugar levels can affect the body's ability to use glucose for energy, leading to feelings of tiredness and fatigue. Blurred vision. Elevated blood sugar can lead to fluid being pulled from tissues, including the lenses of the eyes, affecting the ability to focus. Slow healing of wounds. High blood sugar levels can impair blood flow and cause nerve damage, leading to slower healing of cuts and bruises. Numbness or tingling in hands or feet. Excess sugar in the blood can damage nerves, leading to sensations of numbness or tingling, particularly in the extremities. It's important to note that some individuals may not experience noticeable symptoms, making regular health checkups essential for early detection. Preventing diabetes in older adults. While some risk factors for diabetes, such as age and genetics, are beyond control, certain lifestyle changes can significantly reduce the risk. Healthy eating. Adopt a balanced diet rich in whole grains, lean proteins, healthy fats, and a variety of fruits and vegetables. Limiting the intake of refined sugars and processed carbohydrates helps maintain stable blood sugar levels. Regular physical activity. Engage in at least 150 minutes of moderate intensity exercise per week, such as walking, swimming, or cycling. Physical activity improves insulin sensitivity and helps regulate blood sugar levels. Weight management. Maintaining a healthy weight is crucial. Even modest weight loss can improve insulin sensitivity and reduce the risk of developing diabetes. Regular health screenings. Schedule routine checkups to monitor blood sugar levels, blood pressure, and cholesterol. Early detection allows for timely intervention and management. Managing and treating diabetes in older adults. For those diagnosed with diabetes, effective management is key to preventing complications. Medication. Metformin is often the first-line oral medication for managing blood sugar levels in older adults. It works by reducing glucose production in the liver and improving insulin sensitivity. Lifestyle modifications. Incorporate a balanced diet and regular physical activity into daily routines. These changes can enhance the effectiveness of medications and improve overall health. Monitoring blood sugar levels. Regular monitoring helps track blood sugar control and adjust treatment plans as needed. This may involve daily blood glucose checks or continuous glucose monitoring. Managing comorbidities. Control other health conditions such as hypertension and high cholesterol to reduce the risk of cardiovascular diseases. Regular checkups. Schedule annual eye exams and foot examinations to detect complications early. By recognizing the signs of diabetes, implementing preventive measures, and adhering to a comprehensive treatment plan, older adults can effectively manage their health and maintain a high quality of life. High blood pressure, also known as hypertension, is often called the silent killer. It's a condition that can quietly damage your body for years before any symptoms appear, and when left uncontrolled, it can lead to a host of dangerous health problems, including heart attack, stroke, kidney failure, and vision loss. The good news is that high blood pressure is preventable, and in many cases, manageable through lifestyle choices, awareness, and, when necessary, medical intervention. Understanding the nature of high blood pressure is the first step toward prevention. Blood pressure is the force of your blood pushing against the walls of your arteries. When this pressure remains consistently high, it puts extra strain on your heart and blood vessels. Over time, that strain can cause damage, making your vessels less flexible and more prone to narrowing, thickening, or rupturing. Many factors contribute to the development of hypertension. Some, like aging and genetics, are beyond our control. But an array of lifestyle factors play a significant role, and focusing on these can make a remarkable difference in both prevention and management. Perhaps the cornerstone of prevention is maintaining a healthy diet. A diet rich in fruits, vegetables, whole grains, and low-fat dairy products can lower blood pressure. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is a well-researched eating plan specifically designed for this purpose. It emphasizes foods that are naturally low in sodium and rich in potassium, magnesium, and calcium, minerals that help regulate blood pressure. Reducing salt intake is equally vital. Most people consume far more sodium than their bodies need, largely from processed foods, canned soups, salty snacks, and restaurant meals. Monitoring sodium intake, ideally keeping it below 2,300 milligrams per day, or about 1 teaspoon of salt, can have a dramatic effect on blood pressure. Reading nutrition labels, cooking at home, and flavoring foods with herbs and spices instead of salt can help you gain control over your sodium consumption. Weight management is another essential factor. Being overweight increases your risk of high blood pressure, and even a small reduction in body weight can yield significant benefits. For every kilogram of weight lost, blood pressure may drop by about 1 millimeter of mercury, mmHg. The process doesn't need to be dramatic. Steady progress, eating balanced, portion-controlled meals, and increasing physical activity can lead to sustainable changes. Physical activity itself is a powerful tool. Regular exercise helps the heart use oxygen more efficiently, enabling it to pump with less effort. Activities such as brisk walking, jogging, cycling, swimming, or even gardening for at least 150 minutes a week, about 30 minutes a day, most days of the week, are proven to reduce and help control blood pressure. Excessive alcohol consumption is another factor that can raise blood pressure substantially. While moderate drinking may have some health benefits for certain individuals, overindulgence raises blood pressure and counteracts any potential benefits. If you choose to drink, aim for moderation. Up to 1 drink per day for women and 2 for men. Quitting smoking is critical. Every cigarette raises your blood pressure temporarily, and over time, the damage caused by tobacco can harden and narrow your arteries, making hypertension more likely and compounding its risks. Quitting smoking, even later in life, can have immediate benefits for your heart and blood vessels. Stress management is another pillar of prevention. While stress is a normal part of life, chronic stress or poor coping mechanisms, such as overeating, drinking, or smoking, can contribute to higher blood pressure. Techniques like deep breathing, meditation, yoga, or simply taking time for hobbies and relaxation can help manage stress effectively. Getting enough quality sleep is often overlooked. Persistent lack of sleep or poor sleep quality can raise your risk of hypertension. Aim for at least 7 hours of good quality sleep per night, and if you suspect a sleep disorder like sleep apnea, consult your doctor. Regular monitoring is important, especially as you age or if high blood pressure runs in your family. Home blood pressure monitors are widely available, and checking your blood pressure a few times a month allows you to catch any high readings early. Keep a log and share your numbers with your healthcare provider at regular checkups. While lifestyle factors are essential, sometimes medication is needed, especially if you have risk factors such as diabetes, kidney disease, or a family history of cardiovascular disease, or if your blood pressure remains consistently high despite doing your best with lifestyle changes. Medicine should never be a substitute for healthy habits, but can be a crucial adjunct in preventing complications. There are several classes of antihypertensive medications, each working in a different way. Some of the most commonly prescribed include thiazide diuretics, ACE inhibitors, angiotensin II receptor blockers, AARBs, calcium channel blockers, and beta blockers. For prevention in those at high risk but not yet diagnosed with hypertension, the best medicine is actually not a pill. It's ongoing lifestyle management as discussed above. However, in some situations where blood pressures are trending high, a doctor may begin low-dose medication to help prevent progression. Among these, thiazide diuretics are often recommended as a first-line medication, especially for older adults. They work by helping your body eliminate excess sodium and water, reducing blood volume, and thus blood pressure. ACE inhibitors and ARBs help relax blood vessels by blocking the formation or action of chemicals that naturally tighten blood vessels. Calcium channel blockers relax blood vessel muscle, lowering resistance and allowing blood to flow more easily. The specific choice of medicine depends on your age, overall health, other medical conditions, and how your body responds. Importantly, medication should only be used under the direction and supervision of a healthcare professional. Never start or adjust blood pressure medications on your own, and always communicate any side effects or concerns. The relationship between you and your healthcare provider is your best defense against the silent progression of high blood pressure. In summary, the keys to preventing high blood pressure are found in everyday choices: controlling sodium, eating a balanced diet, maintaining a healthy weight, being physically active, moderating alcohol, quitting smoking, managing stress, and prioritizing sleep. These efforts, combined with regular monitoring and timely medical advice, form the foundation of prevention. Medicine, when needed, becomes an ally in safeguarding your health, but it's these daily habits that shape your future. Be proactive and vigilant, for the best treatment is the prevention you practice each day. As we age, our bodies undergo a variety of changes, making us more susceptible to certain health conditions. Knowing which diseases are most common among elderly individuals, how to recognize their early signs, and taking steps to prevent them can dramatically improve both quality and length of life. Here are the 10 most common diseases in elderly people, what signs to watch for, and how you or a loved one can work toward prevention. First and foremost is cardiovascular disease. This term encompasses problems like coronary artery disease, arrhythmias, heart failure, and hypertension. The risk of developing heart-related conditions increases with age due to the gradual narrowing and stiffening of blood vessels, as well as the accumulation of plaques in arteries. Warning signs can include chest pain, shortness of breath, fatigue, swelling in the legs or ankles, and irregular heartbeat. To prevent cardiovascular diseases, it's crucial to maintain a heart-healthy diet, low in saturated fats and processed sugars. Regular physical activity, managing blood pressure, not smoking, and attending regular health checkups all play a critical role. Next is diabetes, particularly type 2, which often develops in adulthood and grows more common as people age. Early signs can be subtle: increased thirst, frequent urination, unexplained weight loss, fatigue, and wounds that heal slowly. For prevention, focus on a diet rich in whole grains, vegetables, and lean proteins. Managing body weight, staying physically active, and keeping regular tabs on blood sugar levels are essential. For those with a family history, early screening and consultation with a healthcare provider can make a world of difference. Osteoporosis, another pervasive condition in the elderly, leads to decreased bone density and increased risk of fractures. Often, there are no symptoms until a bone breaks, but signs may include loss of height, back pain, or stooped posture. Preventing osteoporosis starts young, with sufficient intake of calcium and vitamin D, regular weight-bearing exercises such as walking or light resistance training, and avoiding tobacco and excessive alcohol. It's also wise to have regular bone density screenings, particularly for postmenopausal women and older men. Arthritis, especially osteoarthritis, affects millions worldwide, making joints stiff, swollen, and painful. It's commonly recognized by chronic joint pain, especially in the hands, knees, hips, or spine. Stiffness tends to be worst after periods of inactivity. Prevention involves keeping joints flexible through moderate activities like swimming, cycling, or gentle stretching. A healthy weight reduces the load on joints, and early intervention when joint discomfort appears may help slow progression. Chronic respiratory diseases such as chronic obstructive pulmonary disease, COPD, are also prevalent among older adults, especially those with a history of smoking or long-term exposure to pollutants. Signs may include persistent cough, difficulty breathing, wheezing, and frequent respiratory infections. Prevention focuses on not smoking, avoiding secondhand smoke or air pollution, staying up to date on vaccinations such as influenza and pneumonia, and exercising regularly to maintain lung capacity. Alzheimer's disease and other dementias are growing global health challenges as populations age. While not a natural part of aging, their risk increases with age. Early warning signs include memory loss, confusion with time or place, difficulty following conversations, and changes in personality or judgment. While we don't have ways to completely prevent dementia, staying mentally and socially active, eating a Mediterranean-style diet, managing blood pressure and cholesterol, getting enough sleep, and engaging in regular physical exercise are all linked to lower risk. Cancer, in its many forms, also becomes more common as we grow older. Cancers such as breast, prostate, lung, and colorectal are particularly prevalent in the elderly. Early symptoms are varied: lumps, unexplained weight loss, persistent pain, changes in skin or moles, or blood in stool or urine should never be ignored. Prevention strategies include routine screenings, not smoking, maintaining a healthy lifestyle, protecting skin from excessive sun, and following recommended vaccination schedules for things like hepatitis and HPV where appropriate. Depression is often overlooked in the elderly, but it can have serious consequences for overall health and well-being. Signs to watch for include persistent sadness, withdrawal from friends and activities, changes in eating or sleeping patterns, feelings of worthlessness, and thoughts of suicide. Prevention and management include regular communication with family and friends, engaging in community or volunteer work, staying physically active, and seeking professional help when needed. Many primary care providers screen for depression as part of routine care. Vision and hearing loss are also incredibly common, largely due to conditions like cataracts, glaucoma, macular degeneration, or age-related hearing loss. Clues can be subtle: needing more light to read, difficulty seeing at night, noticing muffled speech, or turning up the volume frequently. Prevention starts with regular checkups, protecting eyes and ears from injury or loud noises, managing chronic diseases such as diabetes and hypertension, wearing appropriate eyewear, and not ignoring early symptoms. Finally, influenza and pneumonia remain major threats to older adults, especially those with chronic health issues. Elderly people are more vulnerable to severe complications or even death from these infections. Signs include fever, cough, chest pain, shortness of breath, and confusion. Annual flu vaccines, pneumonia shots as advised, hand hygiene, avoiding crowds during outbreaks, and seeking early medical attention for respiratory symptoms are key to prevention. Understanding these prevalent health concerns is the first step toward continued well-being in the golden years. A common thread runs through most prevention strategies for these illnesses: regular physical activity, a balanced diet, avoiding tobacco and excessive alcohol, getting enough sleep, social engagement, and ongoing medical checkups for early detection. Family members and caregivers also play vital roles by encouraging healthful habits and keeping an eye out for subtle changes in behavior or health. Ultimately, growing older does not have to mean declining health. By recognizing the most common diseases in the elderly and actively working to prevent them, one can maximize the chance for healthy, happy, and independent years ahead. If you or a loved one has concerns or is experiencing symptoms, always consult a healthcare professional without delay. Taking responsibility for one's health is not just a gift to oneself, but also to those who care. As we age, maintaining optimal health becomes more challenging, and the importance of nutrition only grows. One cornerstone of healthy aging is ensuring an adequate intake of essential vitamins. These vital nutrients play crucial roles in supporting the health of older adults, from protecting against chronic diseases to enhancing blood circulation and boosting energy. Let's explore how different vitamins contribute to the well-being of the elderly, with a clear focus on the effects of each vitamin. Vitamin A is critical for preserving vision, supporting the immune system, and maintaining the integrity of skin and mucous membranes. In older adults, vitamin A helps reduce the risk of age-related macular degeneration, a common cause of blindness. It also assists with the formation and maintenance of healthy epithelial tissues, helping to keep the body's barriers against infection strong. However, Too much vitamin A can be harmful, so moderation and properly monitored supplementation are key. Vitamin B1, or thiamine, is essential for converting food into energy and ensuring the healthy functioning of the heart, muscles, and nerves. As people age, the absorption of thiamine may decrease, making it important to monitor intake, especially since a deficiency can lead to cognitive impairment, fatigue, and even heart issues. Thiamine helps regulate blood sugar levels and supports proper nerve signaling, both of which contribute to overall vitality and mental clarity. Vitamin B2, known as riboflavin, plays a prominent role in energy production and the metabolism of fats, drugs, and steroids. It also assists in maintaining healthy skin and eyes. For the elderly, riboflavin's antioxidant properties are particularly important, helping to combat cellular damage caused by oxidative stress, which accelerates aging and is implicated in various chronic diseases. Vitamin B3, or niacin, is involved in over 400 enzyme reactions in the body. Niacin is vital for cardiovascular health as it aids in maintaining healthy cholesterol levels and improves blood circulation by causing blood vessels to dilate slightly, a phenomenon known as the niacin flush. This improved circulation ensures that oxygen and nutrients are efficiently delivered to organs and tissues, which is crucial for elderly individuals who may suffer from circulatory issues. Vitamin B6 is a multitasker, contributing to brain health, red blood cell formation, and immune system function. For older adults, sufficient B6 helps prevent memory decline and supports the production of neurotransmitters such as serotonin and dopamine, both of which play a role in mood regulation. Moreover, vitamin B6 is involved in the synthesis of hemoglobin, the oxygen-carrying component of blood, thereby supporting healthy blood circulation and reducing the risk of anemia. Vitamin B9, commonly known as folic acid or folate, supports cell growth and regeneration. Folic acid reduces levels of homocysteine, an amino acid linked to an increased risk of heart disease, stroke, and cognitive decline in the elderly. By helping to keep homocysteine levels in check, folate indirectly promotes healthy blood flow and protects against cardiovascular issues. Vitamin B12 is essential for nerve function, DNA synthesis, and the formation of healthy red blood cells. Many older adults find it more difficult to absorb vitamin B12 from food due to a decrease in stomach acid production. A deficiency can lead to fatigue, memory loss, anemia, and even irreversible nerve damage. Ensuring an adequate intake of B12 supports cognitive health, maintains energy, and prevents circulatory problems related to reduced red blood cell production. Vitamin C, well known for its immune-boosting properties, is also essential for maintaining the health of blood vessels, cartilage, and bones. As a potent antioxidant, vitamin C helps reduce inflammation and mitigate damage caused by free radicals, which accumulate with age and contribute to chronic diseases. Vitamin C enhances iron absorption from plant-based foods, thereby supporting red blood cell production and improving circulation. It also helps strengthen blood vessel walls, reducing the risk of bruising and supporting cardiovascular health. Vitamin D is crucial for the absorption of calcium, maintaining bone density, and reducing the risk of osteoporosis, a significant concern for the elderly. Beyond its skeletal benefits, vitamin D plays a role in protecting against chronic illnesses such as heart disease and diabetes. It also supports muscle strength, which helps prevent falls and associated injuries in older adults. Vitamin D's anti-inflammatory properties contribute to better vascular health, aiding in the prevention of arterial stiffness and improving overall circulation. Vitamin E acts primarily as an antioxidant, protecting cells from age-related damage by neutralizing free radicals. For older adults, vitamin E supports cardiovascular health by preventing the oxidation of low-density lipoproteins, or LDL cholesterol, a key factor in the development of atherosclerosis, an accumulation of plaque in the arteries that impedes blood flow. This vitamin also helps keep the skin supple and can slow the progression of age-related cognitive decline. Vitamin K is often overlooked, but it is essential for blood clotting and bone metabolism. Adequate vitamin K intake helps prevent excessive bleeding and supports the deposition of calcium in bones rather than in arteries, thereby playing a dual role in maintaining both cardiovascular and skeletal health. Vitamin K also prevents arterial calcification and helps preserve the flexibility of blood vessels, contributing to efficient circulation in elderly individuals. Each vitamin brings something remarkable to the table, functioning not in isolation, but as part of a complex web of interdependent processes. For instance, many of the B vitamins work together to facilitate energy metabolism and neurological function, while vitamins C and E cooperate as antioxidants to neutralize free radicals more effectively. Proper blood circulation, enhanced by vitamins such as niacin and B6, is essential for delivering these nutrients to every tissue and organ in the body, ensuring that elderly individuals reap the full benefits of good nutrition. It is important for older adults to discuss their vitamin needs with healthcare providers, since requirements can vary based on individual health status, medications, and dietary habits. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats remains the foundation for obtaining vitamins naturally. But supplements may be necessary to address specific needs or deficiencies. In summary, vitamins play an indispensable role in promoting health and vitality among the elderly. They help protect vision, maintain cognitive and heart health, strengthen bones, boost immunity, and facilitate efficient blood flow. By understanding and addressing vitamin needs, older adults can look forward to more energetic, independent, and fulfilling lives, reaping the abundant rewards of optimal nutrition.